talk about Elizabeth Warren and Tulsi Gabbard and Medicare for All as well.
Yes, I know it's a sad topic.
I love Tulsi Gabbard.
I love Tulsi Gabbard too
because I hate war. I hate war. Like that's
on foreign policy. Tulsi Gabbard is nearly perfect. I mean, other than maybe BDS.
I'm pretty sure she's been setting up to go after Elizabeth Warren on foreign policy in the next debate.
Good.
Ooh, that'll be nice.
Open for it, man. I'm putting my eggs in that basket.
But what do you think? What do you think of Tulsi? Wait, what do you guys both? Everybody
doing? How is she doing?
She's not doing good at all.
I didn't think so. Okay.
No, she's not polling very high, but she's
want to quit. She
on so many issues.
Like, I'm taking it to the convention.
That's right.
She said she's going out. Well, that's not good for Bernie.
Right, I know.
Those are all Bernie. No, most of those are Bernie votes. I would really be upset with her because one thing that bothers me is when she keeps saying, "When I'm president." I'm like, that's the most irrational statement I've ever heard. You're polling at like 1%. What are you talking about? At this point,
we all know. At least be real with us. We all know what this is. You're being there for the progressive backup at this. I mean, and I'm a huge fan. Yeah.
How can you be backing up the progressives when you're like, whatever, on the biggest issue to
progressive?
No, how can you? Like.
So that's a good point. I'm worried about Tulsi. I'm worried about power into her head. I'm worried that she thinks she can win and she could take all these votes for Trump. And now she's also doesn't get Medicare for all. She's got too much of a capitalist mind.
Exactly. My biggest issue. This really broke my heart because Tulsi was like she's one of my top 10 favorite politicians of all time. And there's a couple of things that have been bothering me with Tulsi as of late. And one is the Medicare for All thing where she's been defending private insurance and she uses the right-wing talking points of like choice, which let me get to choice in a second. But and then, she also is defending like duplicate insurance for private, which is essentially fraud. And, she's been making these right-wing arguments on against Medicare for All, or, against single payer anyway, and more in favor of a public option-ish, public option-ish. And so the problem with our choice argument is that you're choosing between different mafias, different mafia organizations. And your choice is, do you want this private insurance which covers your kidneys, or do you want this private insurance which covers your liver? When Medicare for All covers both, it covers everything. And the fact that you're making this choice argument, it's utterly ridiculous because people don't want a choice. They want a choice of their doctors and their hospitals. They don't want a choice of whether or not certain things are covered and certain things are not covered. Oh, I broke my leg. That's covered. But now I have cancer. Sad day for you. You go off and die because you didn't choose. You didn't make the right choice.
Your choice is to pay what we want or go and die.
Yeah. And with
Medicare for All offers a choice of whatever doctor you want. And if it's not Medicare for All, you give the choice to the insurance companies of whatever doctor you want. It's so ridiculous. If you think about it, the American way is not to let people be a middleman. Come in here and take money from us for the doctors. I'm not I don't want to make the government I would not be for Medicare for All if it was government health care. I would. But it's not.
And limitations to what you're allowed to do. And adding limitations is like and we pay them for it. Why do we pay them for it?
Yeah.
Right.
Yeah. Not only do we pay them for those limitations, but then we also have to pay, like after, you have your premiums, deductibles, and copays.
Yep. Those will all be gone under Medicare for All.
There's a month for insurance we can't even afford to use.
Yeah, I like that what you said too. I like that what you said. What did you say a minute ago? You said, oh shit, I lost it, but it was good.
Sorry. But anyway, the point is, not only would it get better quality care, better results, and better outcomes, it would also have the added benefit of covering every man, woman, and child in the entire country. I'm speaking of Medicare for All. And Medicare for All compared to our current for-profit private health insurance system, according to a study done by the University of Massachusetts Amherst, found that Medicare for All would actually save the American people $5.1 trillion over the next 10 years.
Yep, that's even, a good study.
Probably more, because probably more. Because you have to keep in mind how much money is being wasted because we're waiting to go to the doctor until it's dire. And then we're going
exactly. It would save the American people even more because they wouldn't be waiting until they absolutely have to go to the hospital when it's going to cost the most to treat them.
And then you go to the emergency room. Yeah, exactly. And it costs the most. And then those people don't pay anyways. Nobody pays the emergency room unless they already have a whole bunch of money.
Exactly. And in addition to that, even under the most conservative estimates, with a study that tried to discredit Medicare for All, as you probably most everybody knows at this point, the Marcana Institute study, which that was a Koch brothers funded right-wing study. The entire purpose of it was to discredit Medicare for All, and even that found that it would save Medicare for All would save the American people $2.1 trillion over the next 10 years. That's worst case
I got to ask a question.
Scenario.
Okay, so how do we explain this? Because I've been on the Tulsi people are going crazy right now. Okay, and they're all trying. And look, I'm a Tulsi person. I like Tulsi. I'm not going to vote for a president because I'm going to vote for Bernie.
Vote for Bernie, but she was my second choice.
But how do you explain to these people? They don't understand. They keep thinking because Tulsi is either confused or she's lying. I'm going to say it. I give her the benefit of the doubt, but she comes out and she's doing doublespeak. She says, Medicare for all. I don't have the exact quote here, but she's like, I'm in favor of Medicare for all, but I'm in favor of private insurance.
So
the exact quote. You can't say that. That's double.
I 100%. I was actually debating a Tulsi Gabbard supporter the other day, and what it came down to was like she needs to come out with her next statement on Medicare for all, and she needs to clear things up, or like she needs, because what she's saying now are regurgitated right-wing talking points, and they don't make her position look good. And if she misspoke, then she needs to clear this up. Otherwise, I don't think I can support Tulsi with this kind of position.
Remember when they had to raise their hand? Everyone was supposed to raise their hand. And no, I'll let you go next. Remember during the debate, the second debate, they said, who's willing to get rid of private insurance?
Yeah, I remember.
You guys remember that? Mm-hmm. Tulsi didn't raise her hand. Tulsi has never, ever, I've been watching it the whole time. She's never said, I'm in favor of eliminating private insurance. She's never said it. Once.
She did an interview after the second debate where she said, this was a couple of weeks, I don't know, when was the second debate? She said, I think that taking away their choice to keep their private insurance is not a
with Anderson Cooper
thing to do.
Yeah, she said un-American.
I was not surprised at all when she came out and said this. I'm surprised that they didn't catch it until now. You know that they've been trying.
I caught it. I've known it the whole time, and everybody's like, no. I'm like, dude, she never has said it because it's the clearest. This is how you catch them because this is what you decide if you are progressive or not. Are you scared of socialism, or do you understand that that's a fear tactic? Do you understand that Medicare for all is not socialist? It's democratic socialism, and taking away private insurance is not an anti-capitalist thing. It's actually the best choice for the people.
Well, I think it is.
Calls his breakfast socialist when his eggs are overcooked. Like they don't know what it means anymore. They say it for everything. Everything is socialist. Biden's socialist. Trump is socialist.
Biden socialist.
They don't even know. They can say it all they want. It's lost all meaning. It's like how many times have they said it this hour? They don't know what socialism is. They know that Bernie's saying it's something different. What they understand is free college, health care that you can use. That's why he appeals to independence. He says it in a way that people can understand. He doesn't throw out socialism is bad every 10 minutes to try to.
I would argue that many of the Medicare for all and
the argument they got.
Tuition-free public college and universities I think they are socialism, but I wouldn't shy away from socialism label because I completely support it. And it can be different things to different people.
I hate the labels. I say no ism.
I know.
I don't like capitalism, socialism. I'm trying not to use those words anymore because there's no country that's a socialistic country, and there's no capitalist country. Almost every country is actually dictatorship these days. And they all have different parts of it.
I'm sorry. I do like this. They are different things to different people, and you should stop and hash those things out to see where your actual positions are. I think the labels more help you find a kind of a rough outline of where a person stands, as opposed to don't let that define the conversation.
No, but that it does. It's running the conversation these days,
But go ahead. Sorry.
So can I say something? So what the Tulsi supporters have been saying, I don't know if you've been catching it, but they're saying, okay, so someone came out and said, okay, what Tulsi is advocating for is a public option, right, where you can opt into your private whatever. And now what the Tulsi supporters are arguing for is that no, it's not a public option, it's a private option. But what that does is
that's a public option.
What is that?
Technically, it's a different thing, but what it does is it ignores how Medicare-For-All and single-payer systems are actually designed, which is that all of the people in the system are in the same risk pool. The healthy people and the sick people, the rich people and the poor people, they're all in the same system. And so all of the risk is minimized as a group because fewer people in that group, a smaller percentage of people get sick. And so
that's a great point.
System, as opposed to now, the current model is designed to maximize the most possible profit off of every single individual. So instead of being taxed as a group, we're taxed as an individual, and it's 3 or 4 times the rate of what it should be in a lot of cases. You know, especially when you end up paying like copays and deductibles and having like massive fees for surgeries and things like that. You know, it's just an unmanageable cost. And having a private system or a public system or public option, creates a 2-tiered system in which the public option, aka Medicare-For-All, would be so severely underfunded that it would not take any priority. The people on the system would receive lower quality care and would be second choice for doctors. And on top of that, the system
2-tiered healthcare system.
Yeah, because it would only be made up out of sick and poor people, it would actually be unviable. It would not have enough funding.
Right.
Because there would be no people paying into that, and the only people would be costing tons of money because they're
so
sick.
then
right.
So what happened was that's what Obama did, and then they had to charge that money. So they said now we got to charge this extra money to everybody, the tax. And then Obama's like, so the thing is, what they're saying, opt out is like, okay, we're gonna, first of all, it's single payer, right? That was good, Jocelyn. You explained it well. Single payer means one payer. You can't say, I'm gonna have a single payer, but we're gonna have some other payers too. That's what Tulsi's trying to say. You can't have a single payer with other payers. You have one payer, the government. That's how it works. If you're saying opt out, if you're rich, you don't have to be part of society. Everyone has to take care of each other, except for the really rich people that can pay for their own. They don't have to help out.
The only time there should be a private insurance in single payer is when it's a supplemental private insurance with elective procedures. If you want to get a nose job but like something that's not like an immediate health, or not immediate, I'm sorry, anything that's not a significant health issue, you know?
Yeah, and now something up too. There's something really big that I loved about it because I was really worried about Medicare-For-All, so I've studied it really pretty decently. And they even allow for like, okay, so you can get private insurance if a new medicine comes out. Like, let's say there's this new hippie type practice, you know, like Reiki or something. They allow Reiki actually, which is crazy, but Bernie's thing lets these in. But if they first come out, you can have private insurance on them until they tell the government will opt them in as an actual medical practice. But they actually take acupuncture and Reiki. Dude, no insurance takes acupuncture and Reiki right now, but this Medicare-For-All will.
That's great.
Hey guys, I'm gonna probably end up cutting out here in a minute.
All right.
My
I'm sorry.
about to die, and I don't have a place inside to charge.
No, let's wrap it up.
I live with other people, so.
No, that's great. We can wrap it up. This has been a good conversation.
Yeah.
No problem.
Do you have enough time for just one more thing I wanted to mention?
Let's do it.
I wanted to bring up one more thing with Tulsi. I don't like dunking on Tulsi too much, but you know, when you do wrong and you're a candidate for president, stuff has to come up. She went on Dave Rubin's show recently. I don't know if you guys saw this, where she did not push back on right-wing framing. So, and I don't mind you going on, you know, Bernie Sanders went on Fox News and things of that sort. I think that can be a very good way to reach an audience you wouldn't normally. But Tulsi Gabbard did not push against Dave Rubin's right-wing framing of like identity politics, for example, where he's like, identity politics makes the left like so much worse and it's terrible and it's awful and horrible. And there are establishment Democrats, you know, there's moments of the left that'll use it as weaponize identity politics to like, you know, deflect from actual criticisms. Like, oh, you can't call Hillary corrupt or else you're sexist. You can't call Pete Buttigieg this or you're a homophobe or, you know, you're racist for Obama if you call him corrupt.
I was called anti-LGBT for being a Tulsi fan for a while.
Right, but like but the thing is, so with that that's fine to go, yeah, you are right, there is some fringe of that on the left and it needs to be addressed, but it's just as bad, if not worse, on the right. I mean, you have Ben Shapiro calling people like anti-Semitic for supporting BDS for humanitarian reasons. I'm sorry, Jocelyn or Erica. I'm sorry, I'm not letting you guys talk. I don't want to take everybody's time, so go ahead.
Oh no, I was just gonna say, I think that one of the reasons that she's not pushing back about right-wing framing is, Tulsi gets a lot of her support, or you can debate me on this. I think she gets a lot of her support from the Joe Rogan audience.
She does.
When Bernie went on his show, Joe Rogan brought up Tulsi Gabbard and said she's my favorite candidate. And you know what? A lot of guys who are really interested in foreign policy, they're really interested in what's going on in the wars and everything. And that's a lot of men and women. They're interested in that anti-war message, and that's for
which is good.
And
to get that, at least get that out there.
And so she's used to playing to that kind of audience, and I don't know that it even.
Yeah, she's playing to the independents.
Framing on it, because I imagine a lot of people have come at her with that kind of framing. So.
And it's politics. Right. It's a hard game. Yeah, I understand.
I mean,
and if she did, Bernie did pick her up, and that was the plan, which is not looking like it so much. But if that was the plan, then she'd bring those votes, and it would. But she would have done it, But
you should use those platforms to get those. I'm sorry. Go ahead. If you got
no. Sorry, no. Keep
going. No, go ahead, Josh.
You should use those platforms to get people to sway people to your policy beliefs. I mean, Bernie Sanders went on the Joe Rogan podcast. Kyle Kalinske goes on the Joe Rogan podcast, and they don't bend.
She's trying to win, right? It's really hard because if you imagine yourself.
So is Bernie.
But Bernie's not talking to the people she's talking to. They're talking to different crowds. And when you're talking to these crowds and you know who your followers, it actually turns into the followers make you say what you have to say. You get so many followers. Trump didn't make any of that shit up. Everything Trump says is what they told him. And he said, this is what they like to hear. Like, we really develop these people. I think Bernie, even his ideas weren't all his ideas. Some of them he's been preaching for 30 years.
Like, some of the recent ones, like canceling all medical debt and student loan debt. Those are recent new ones that exactly. But that's a good listen. That's like an evolve on a position where you got to get there. And I wish Tulsi would be better on these issues, and it really is unfortunate, and it is disappointing, and it is heartbreaking to hear her say things like this.
A lot of people have been saying that they've been wanting her for VP. I don't think that I don't think that at least Bernie should pick anybody for VP who isn't 100% behind Medicare-For-All. I supported Turner for VP.
That's a litmus test for me, Medicare-For-All.
Well, then he's not. He doesn't have a vice president.
Number one issue is want to stack the Senate, or the House,
he does. I know who he could pick. So who do you think he should pick for vice president?
Nina Turner.
There you go.
There you go. And then Tulsi could be Secretary of Defense.
My phone's dying here, guys.
I'm sorry. I keep
wrapping up.
Cutting you off in the end. I apologize.
Hey, thank you guys. This is Adam, Erica, Jocelyn, and Joshua Hill, and we are TCSN Live. We're back. We'll see you guys on Wednesday night, same time. Peace out.
Hey guys, thanks, Josh.
Peace.
Thanks, Josh. Jocelyn.